Good afternoon, everyone, and welcome to my Friday message. There's lots of great news to share this week. This spring was full of wonderful events to recognize the achievements of our amazing faculty in person after a 2-year hiatus. We are so fortunate to have beautiful outdoor settings on our campus to hold these events. On May 10th, we had the Spring Faculty Celebration, recognizing the excellence and commitment of faculty across all our missions. And on May 18th, we had the Distinguished Professor Ceremony, recognizing faculty across campus for this major career accomplishment. Due to the limitations of the last 2 years, recipients from the last 3 years were recognized that evening and included the 16 faculty members of the School of Medicine who were awarded distinguished professorships in 2022. The occasions were truly joyous ones. Each of the faculty honorees were celebrated on our School of Medicine Twitter postings, which I encourage you to follow. Congratulations to all. And congratulations to Tomi Akinyemiju, as well as Becker and Becky Smith. Tomi and Mara were selected as members of the 2022-2023 class of fellows for the ELAM program at Drexel University. Becky was selected as one of the inaugural fellows for the Parallel Executive Leadership in Healthcare program. ELAM is a prestigious year-long fellowship aimed at expanding the national pool of outstanding women candidates for leadership across the disciplines in academic medicine and health. These are well-deserved honors for these 3 women. I also want to congratulate Gloria Johnson-Bass. Gloria was awarded the 2022 Susan B. Clark Administrative Leadership Award, which recognizes a Duke Health administrative professional who exemplifies the qualities of dedication to the institution, service to others, personal strength of character, and acting as a role model to others. Gloria has worked for Duke Health for 41 years. Now some COVID updates. Locally and nationally, we have seen a steady and slow increase in COVID cases and hospitalizations over the last few months. That said, in North Carolina, there was a slight decrease in the number of cases and number of deaths from COVID this week, although it is a little early to say that this is a trend. Nationwide, hospitalizations due to COVID have increased slightly, consistent with what we're seeing at Duke University Health System. There are currently 88 patients hospitalized at Duke due to COVID, up from 64 last week. Hospitalizations, fortunately, still remain well below the levels we've experienced with prior surges. About 25,000 people are currently hospitalized with COVID nationally, compared to more than 150,000 in January. So across the United States, we're seeing similar data, perhaps a plateau or slight decrease in the number of cases from the previous weeks. The latest variant data is that as of May 21st, indicates that BA.2.12.1 is the predominant strain, or soon to be the predominant strain in most areas of the country. More recently, there have been sublineages identified, BA4 and 5, first identified in South Africa, and now with single reported cases in the United States. Each of these sublineages are somewhat more transmissible than the prior parent Omicron strain, but do not cause more severe disease. While prior vaccination or infection with the Omicron early variant does not completely protect against infection with subvariants, the vaccine is consistently associated with protection from severe disease and death, particularly with the recommended boosters. We are closely watching all the data. I continue to encourage everyone to make personal decisions regarding activities and masking based on your own circumstances and the local infection data. So let me report some good news on the vaccine front. On May 23rd, Pfizer shared safety and efficacy data from their clinical trial evaluating a 3rd dose of its COVID-19 vaccine in children 6 months to under 5 years of age. The company announced that children in that age group who received a 3rd dose had a strong immune response with a favorable safety profile similar to placebo. The vaccine was 80.3% effective in children. The FDA has announced that the Influential Vaccines and Related Biologic Products Advisory Committee plans to meet on June 15th to consider applications for both Pfizer and Moderna to authorize vaccines for our youngest children. This is great news, and we'll be watching closely later this month for the FDA's decision. Lastly, the May 27th MMWR report from the CDC evaluated the incidence of long COVID using electronic medical record data covering the period of March 2020 to November 2021. Long COVID was defined by the persistence of or new onset of a fairly long list of symptoms greater than 4 weeks beyond an acute COVID episode. 1 in 5 COVID-19 survivors age 18 to 64 and 1 in 4 survivors over 65 years of age experienced at least one incident condition that might be attributable to a COVID infection. These numbers are consistent with other studies, the most common symptoms being respiratory or pulmonary embolus, but the list of symptoms is long, including neurologic and mood disorders. Several studies have reported these findings, and most noting a decrease in these post-COVID symptoms with time. That being said, we have a lot more to learn regarding the longer-term implications and potential interventions. And the good news is there are major sponsored research efforts going on now to really look at this across the US. As recommended by the CDC report, routine assessments of people who have been infected with COVID, particularly in adults over 65, should be for these persistent symptoms, and this will be important in defining the longer-term implications. Finally, I hope you will join me for my annual State of the School address next week on Wednesday, June 8th at 5 p.m. This year, the address will be held in person in the Great Hall of the Trent Siemens Center. You can also view the address real-time through live streaming at the URL on this slide. All faculty, staff, and students are most welcome. As always, I want to thank everyone for all that you do and have a restful weekend.